there, welcome back to the Mental Path podcast. I'm Dr. Gretchen Gavero, psychiatrist, psychotherapist, and your guide to practical strategies for your mental health. We've been talking a lot this season about thought reframing and building healthier habits. Today, we're deepening that conversation, talking about something that really needs more clarity and less stigma, which is bipolar disorder. Before we start, this episode is for education, not medical advice. There's no patient information here. If you're my patient and anything sounds familiar, please know the experiences I describe are common patterns, not specifics about you. What is bipolar disorder? Bipolar is a mental health condition that causes intense shifts in mood, energy, and behavior. They're not your normal mood swings. They're usually extreme episodes that can seriously disrupt life. There are two main types. Bipolar 1 has at least one manic episode. It can show up as a period of very high energy, racing thoughts, impulsive behaviors, feeling like you don't need to sleep, and sometimes risky or disorganized actions. Mania can include psychosis like hallucinations, paranoia, or believing things that aren't based on reality. It can even show up as catatonia. These are odd movements or a complete shutdown in movement and how you respond. Sometimes it can show up as not eating, drinking, or moving. Manic episodes should not be taken lightly. They can alternate with depression or sometimes overlap with it, which can make this condition even more complex. In bipolar 2, people experience hypomania. That's a milder form of elevated mood and usually comes with major depressive episodes. It's trickier to catch because hypomania can look like just being super productive or feeling great for a few days. Knowing how to spot the signs matters a lot because bipolar, especially bipolar 2, it's frequently misdiagnosed. Usually, people seek help for depression, and if the hypomania is missed, they're prescribed antidepressants that can usually trigger or worsen manic symptoms. Some red flags that I look for clinically are poor or inadequate response to antidepressants, worsening symptoms after starting antidepressants, or fluctuating energy levels that don't really match your typical depression patterns. That's why having a skilled, thorough provider makes all the difference. I cannot emphasize that enough. You need a doctor that you feel safe with, you can be open with, and you can trust. They have to be comprehensive in approach. Treatment has to look at the full picture, not just a snapshot. So what causes bipolar disorder? There's no single cause, and actually, it's not exactly clear. What we know is that it's a mix of biology, psychology, and environmental factors all interacting together. For example, genetics. If you have a parent or a brother or sister with bipolar, your risk is higher, but it's not guaranteed you'll also have this condition. Then there's the brain structure and chemistry. Studies show differences in the brain's emotional regulation centers in bipolar. Also, big life changes, huge stressors, losses, or even substance use can trigger episodes. Bipolar affects men and women equally, and most people experience their first major symptoms before age 30, usually around 18 to 24 years old. At least that's what I'm seeing in my practice as well. I've seen so many cases where the first manic episode shows up during early adulthood, like college, grad school, or early career. That's usually when life stress is high and, unfortunately, when substance use like heavy alcohol, marijuana, stimulants, or uppers like cocaine is more common. Some of the most complicated cases I've come across involve early adulthood onset mixed with drug use, and it makes diagnosis and recovery even more complex and takes a long time. Still, managing bipolar disorder is possible, but it's not a one-thing-fixes-all situation. It's about building a strong foundation. And on the top of my treatment plan list is always lifestyle. Your body sets the stage for your mind. Your sleep, balanced nutrition, regular movement, and avoiding substances create the foundation everything else builds on, especially in this condition. In fact, sleep disruption is usually one of the first signs people describe when mania starts creeping in. Most people with this condition I've taken care of eventually needed medications. With that lifestyle foundation in place, the right meds can help stabilize mood swings, setting a steady baseline. Again, each person is unique, and the need for medications must be individually tailored. In some cases, a genetic test can be helpful in guiding medication use. And whether or not someone chooses to take medications is such a personal choice, and an honest discussion about this with your doctor is so important. It should not feel rushed, and the information has to be easy to understand so you can make an informed and confident decision. Psychotherapy is also very helpful. It gives you real tools to manage stress, emotions, and thought patterns. Another important piece is your support system. Family, friends, therapy groups can be very helpful in your treatment plan. One more thing, again, it's so important to find a psychiatrist you trust. Someone who doesn't just prescribe meds, but actually helps you build fundamental coping skills and understands the big picture. Healing isn't about one magic solution. It's really the combination of science, skills, and support that helps you stay grounded and get back to your life, your relationships, and your goals. Okay, let's clear up a few myths about bipolar. Myth number 1. Bipolar means you're happy one minute and sad the next. Well, what I've seen is that the mood shifts are longer, more intense, and usually disruptive, not moment-to-moment changes. Myth number 2. People with bipolar disorder cannot live stable lives. That is not true for everyone. With proper treatment and support, many people live full, successful, meaningful lives. I've seen this many times. Some people's journey may be long and episodes can be complex and super challenging, but they can still get back to some level or even reach a full level of functioning. There are really many variations of experiences, and I encourage you not to just focus on the worst-case scenarios. Instead, focus on the next helpful step towards health and stability. Myth number 3. Bipolar is rare. Okay, it's much more common than most people realize, and stigma only adds to the challenge. In my work at the hospital and outpatient settings, this idea may be because it's usually misdiagnosed or missed. It's a tricky condition for some. And unfortunately, it's caught when it's gone untreated for too long that it's already caused significant life disruptions. The key is to acknowledge that bipolar disorder exists, and with some basic information, we can recognize it sooner and address it earlier. So how do we do that? The signs of mania or hypomania might be feeling unstoppable, energized or wired, needing very little sleep, talking quickly, jumping between topics. Some may make risky, impulsive decisions that are out of character. The thing to note is that these symptoms are causing problems or changes in how you show up in your life, like how you take care of yourself, how you do your job or perform in school, how you manage your money, or how you relate to others, etc. Sometimes bipolar coincides or alternates with depression. Depression can look like feeling sad, empty, or hopeless, losing interest in things you usually love, having low energy even if you feel like you're sleeping enough, or those harsh self-criticism or guilt can start to creep in. Catching these patterns early makes a huge difference because early intervention usually equals better outcomes. Supporting someone with bipolar disorder can be challenging, but it's still possible and can be powerful. Here's a simple framework. 1. Focus on psychology, that's the mind. Listen without judgment, educate yourself about bipolar disorder, and encourage consistent therapy and following their treatment plan. Next, addressing physiology or body function. You can help support basic routines like good sleep, regular meals, and daily structure. You can offer calm, steady energy without pressuring them. Last, you can be a positive addition to their environment. Be a reliable, consistent presence. Those quick texts, check-ins, small acts of showing up, they matter so much. Your patience is powerful. Your steady presence reminds them they're loved, even on the hard or confusing days. As a psychiatrist, safety is always at the top of my mind, especially in manic or depressive episodes. You can help your loved ones create and sustain a realistic safety plan. Bipolar disorder is not a stain on someone's character. It's a medical condition and it can be manageable. There's real hope and help is available. If any part of this conversation resonated with you or made you think about someone you care about, please take it as your cue to stay curious, compassionate, and connected to good resources. If you're experiencing mental health challenges, you're not broken. Healing happens when we understand and act with kindness to ourselves and to others. And speaking of healing, our next and final episode of Season 2 is going to hit close to home. It's about understanding why you're stuck in survival mode and how to reset your brain to stress less. I'll break down why you might feel constantly stuck, how your brain is wired to keep you there, and most importantly, how to get out of it. You know me, I'm all about actionable skills. It's a little sneak peek into my upcoming online course, so if you're ready to feel more grounded, more energized, and less burned out, make sure to come back next week. Okay, thanks again for joining me today. Remember, when you take care of your mind, you take care of everything else. See you next time.